Hi friends, welcome back to Complete Medical Coding. Today let's discuss few more mock questions, some important mock questions from the CPC examination. Today I will explain how to save time. I will show you how to save time in each and every question. Okay. So friends, if you are new to the channel, please support me by subscribing to the channel. And let's move to the questions one by one. First question. A 28-week pregnant 35-year-old established patient with thoracic and low back pain requests osteopathic manipulative treatment to her back. There is short form for osteopathic manipulative treatment, okay, OMT. Sometimes they will mention only OMT, osteopathic manipulative treatment. Osteopathic manipulative therapy is done on 1 to 2 body regions for somatic dysfunction. Therapy is performed by high velocity, low amplitude. Muscle spasm is not present. What CPT and diagnosis codes are reported for this encounter? So here in this question, the patient is 28-week pregnant. But what is the current treatment going on for this patient? Osteopathic manipulative therapy, right? So here, since the patient is 28-week pregnant, you know that number of gestation should be included in the diagnosis, right? It should be included in the diagnosis as the it should be reported as one of the additional add-on diagnosis. So, if you can check the options, see here I am just telling you how to save time for your examination, okay? If you check the codes, options, you can see the 28 weeks gestation is mentioned only in options A and D, right? Z3A.28. Z3A.28 is present only in options A and D. In options B and C, nothing is there, and in option B it's 35 weeks. So we can directly skip options B and C. So you have to now concentrate only on options A and B. So 2 options you have already skipped out. Now when you check options A and D, see CPT code is only one. And what is the procedure done here? Osteopathic manipulative therapy. So only one CPT code, only one procedure is done here. That you have to find it out. So just open CPT code book and go to the first CPT code in option A, 98925. So if you can check 98925, that is the osteopathic manipulative treatment. 1 or 2 body sessions, body regions involved. This is the CPT code that we need. Still you check the other CPT 98943 in option D. 98943 is chiropractic manipulative treatment, extraspinal. This is not chiropractic manipulative treatment. This is osteopathic manipulative therapy. See, so you can skip option D. So we already got the correct answer as option A. See, in how many minutes time with explanation I have done? Almost 3 minutes. And that includes I was just explaining you, right? So with explanations and everything, we got the answer as option A. You can save time, like you will take less than a minute to answer this question. This type of question, not like this question, this type of such questions, you have to first sort it out from the options. What all we can skip, what all we have to concentrate. Okay, so by that way you can save the time in your examinations. So we already got the answer as option A, because 98925 is the osteopathic manipulative treatment which is done in this procedure, in this question. Then I'll just explain you the remaining diagnosis as well. What is O99.89? O99.89, it is common in all options also. So O99.89, other specified diseases and conditions complicating pregnancy, childbirth and puerperium. M54.6 is thoracic pain, M54.5 is low back pain, and Z38.28 represents 28 weeks gestation. So, as I told you, the answer is option A for the osteopathic manipulative therapy or osteopathic manipulative treatment, OMT. Okay. Now, second question. A 22-year-old male is coming in for his immunotherapy to desensitize him to rugweed. The physician provided the serum with the allergenic extract and performed the injection. After the injection was given, the patient was observed to make sure he did not experience an allergic reaction. He was told to return in 3 days for his next injection. What CPT code is reported? So here the patient is visiting the physician's office for getting the injection rugweed. Okay, injection. So like immunotherapy procedure. So what procedure we have to, what CPT code is reported here anyway, they have not asked for any diagnosis, it's only the procedure which is done. We have to code for the injection procedure, okay. Let's go to the options directly. What is CPT 95115? Professional services for allergen immunotherapy. This is allergen immunotherapy codes. These are allergen 95, starting 95 are allergen immunotherapy codes, okay. So 95115, professional services for allergen immunotherapy, not including provision of allergenic extracts, single injection. Not including provision of allergenic extracts. Here in the question, it is mentioned the physician provided the serum with allergenic extract. So this code is incorrect. It's not our answer. Now what is 95145? Professional services for the supervision of preparation and provision of antigens for allergen immunotherapy. This is not supervision. This is given. The injection has given. So this is not supervision. So we cannot quote 95145. And if you check 95144, that is also supervision. Professional services for the supervision of preparation and provision of antigens. This is also not supervision. So this is also not the correct answer. What is 95120? Professional services for allergen immunotherapy in the office or institution of the prescribed physician or other qualified healthcare professional, including provision of allergenic extract, single injection. So including the allergenic extract. So this is what our answer is, 95120. So correct answer is option D. Okay, 95120. Now let's move to the third question. Preoperative diagnosis. Atrial fibrillation. Operation. Direct current cardioversion. Procedure. After obtaining informed consent, a direct current cardioversion was performed. The patient was given sedation by a member of the anesthesia department. A 120 joules of synchronized shock was delivered, but atrial fibrillation appeared to persist after a few sinus beats. A 200 joules of synchronized biphasic shock was delivered. Once again, sinus rhythm was restored, but only for 50 seconds. Then a second 200 joules of synchronized biphasic shock was delivered, and this time sinus rhythm was restored and persisted. Conclusions. Successful direct current cardioversion after a few attempts with restoration of normal sinus rhythm. What are the diagnosis and procedure codes? So initially, if you get a question like this, like a big story question, this is not actually big, you will get like questions bigger than this, okay. Still, you have to read just like one time, you can just read the whole question and just identify from the question what are the procedure done. Even though it is mentioned initially, what is the diagnosis? See, here in the question it is written preoperative diagnosis. Means, what does preoperative and postoperative diagnosis means? Preoperative diagnosis means before the procedure, what is the diagnosis? That to rule out it means it's not a confirmed diagnosis. We cannot quote that. Okay. Sometimes the diagnosis will change after the procedure. So, in some questions, preoperative and postoperative diagnosis are same. But in some questions, preoperative diagnosis is not the same as the postoperative diagnosis. So, that you need to identify from the question. Procedure anyway, they will give it in detail, that we can find it out from the, that you need to check out for the CPT codes, okay. But if you can find exactly the diagnosis code, then you can skip some few options from the question. So here preoperative diagnosis is atrial fibrillation, okay, and operation means the procedure, direct current cardioversion is a procedure done. And what is a postoperative diagnosis? It's not mentioned that word postoperative diagnosis, but see, conclusion. Successful direct current cardioversion after a few attempts with restoration of normal sinus rhythm. Yeah, here postoperative diagnosis is not mentioned. Okay. So in that case, you have to, from the explanation, from the question, from the detailed explanation given, you have to identify whether the preoperative diagnosis is same as the postoperative diagnosis, what the doctor has concluded. Finally, here the doctor has concluded the same, what has there before, right? So that is why they have performed all this procedure. Yeah. So let's move to the options, codes, the coding system. You have to always check for the diagnosis in such type of descriptive question. It's better to check always for the diagnosis first, to find out the diagnosis first, okay. So what is I-48.91? Unspecified atrial fibrillation. I-48.91 is unspecified atrial fibrillation. What is I-48.0? Paroxysmal atrial fibrillation. That is not the correct one. Paroxysmal atrial fibrillation, it's nothing mentioned in the question. And what is I-49.01? Ventricular fibrillation. That is also wrong. So atrial fibrillation is the only diagnosis that we can quote, right? Unspecified. That's why it is mentioned unspecified. So I-48.91 is our ICD code, which is there in options A and B. Now you can check for the CPT codes. 92960, if it is 92960 or 92961. What is 92960? Cardioversion, electrical conversion of arrhythmia, external. And 92961 is the same description, internal. So what is done here? Is it external or internal? How can you identify that? Yes. See, 92960, cardioversion, electrical conversion of arrhythmia, external. Here, what is the procedure done? Direct current cardioversion. So direct current cardioversion means it is the external procedure. It is the external. Okay, that is what the word difference from the codes 92960 and 92961. 961 is internal. If in the question it is direct current conversion, direct current cardioversion, that is the external procedure. Okay. So we got the answer as option A, 92960 and I-48.9. Now fourth question. A surgeon performs a cholecystectomy for a patient with cholecystitis. The removed organ is sent to the pathologist for gross and microscopic examination. What CPT code is reported for the surgical pathologist service of examining and reporting on the specimen? So here we have to code for the surgical pathology, right? Surgical pathology, gross and microscopic examination. These are the codes given. Let's look into the codes one by one. See, initially you will find it difficult for coding surgical pathology, but it is easy. Let me explain you how to check. See, what are the codes given in the options? 88, 307, 302, 304 and 300. So let's begin with 88300. Before that, what is the surgical pathology, in which part or in which organ the surgical pathology has been carried out here? The patient was having, the surgeon performs a cholecystectomy for the patient with cholecystitis. So you have to know the medical terminology, the anatomical term, the medical term for cholecystectomy. Then only you can answer this question. So what is cholecystectomy? You know that ectomy. Ectomy means removal. So removal of some part. That is what ectomy means, right? What is cholecystitis? Cholecystectomy. That word chole means gallbladder. So cholecystectomy refers to removal of gallbladder. So from these codes, from the surgical pathology codes, you have to identify the surgical pathology, gross and examination for gallbladder, in which code the gallbladder organ is present. Okay. So go to the codes one by one. 88300. It's level 1 surgical pathology gross examination only. 88302 surgical pathology gross and microscopic examination. Gallbladder is not mentioned in 88302. What is 88304? Surgical pathology gross and microscopic examination. If you can check, see, gallbladder is there. So this is the correct one. And if you check 88307, also there is no gallbladder. Okay. So for the removal of gallbladder or for cholecystectomy, surgical pathology, gross and examination, the correct answer is option C, 88304. In that list, if you check, you will identify the presence, like gallbladder is present. So for cholecystectomy, you have to code the surgical pathology code 88304. This is how you need to find out the CPT codes from surgical pathology. Okay. So you have to, for that you need to know some medical terminologies. Otherwise, you cannot answer this question. Now let's move to the fifth question. An MRI is taken to confirm the diagnosis of a subperiosteal abscess, also called as SPA. Okay, subperiosteal abscess between the orbital bones and left periorbital, caused by a staphylococcus infection. The MRI is performed first without contrast material and then followed by contrast materials and further sections. An independent radiologist reads the MRI, confirming the diagnosis. What are the CPT and ICD-10 codes reported for the radiologist services? So, if there is any questions like this from radiology, it is easy to find the CPT code first rather than diagnosis. And if we can check the options also, only one procedure code is there, right? Because here in the question only one procedure is done, MRI. So only one CPT code is there. But if you check the diagnosis, it is more. So better to go with, better to find out the CPT code first in case of radiology questions, so that you can save the time here. Okay. So go to the options. What is the procedure done here? MRI. Here first is without contrast material and then followed by contrast material. So MRI is the procedure done here. Okay, let's go to the options one by one, then I'll explain it to you. What is the first CPT code? See, if you check the CPT codes, 70542, 70540, 70543, 70546. So what is the first one? 70540 to 546. 540, 542, 543 and 546. From that, we will find out which is the correct one. Okay. So just open CPT code book and what is the first one? 70540, which is the first one in that series, first CPT in the series. Okay. 70540, magnetic resonance imaging, orbit, face and neck without contrast material. This is only without. What is 70542? With contrast material, only with. What is 70543? See, without contrast material followed by contrast material and further sequences. This is what we need. This is what is mentioned in the question. The MRI is performed first without contrast material and then followed by contrast material and further sections. So, which is exactly mentioned in CPT code 70543. Let's check what is 70546. Magnetic resonance angiography head. This is not MRI, this is MRI, magnetic resonance imaging. So we already got the correct answer, right? So simple. In less than a minute, you can find the answer for this question. Because we got the correct CPT code as 70543 in option C. Along with modifier 26, because this is a professional component. So you have to append it with modifier 26. Now just check the ICD code also. I'm just explaining you. What is H05.022? Osteomyelitis of left orbit. H05.022 represents osteomyelitis of left orbit. And what is B95.7? Other Staphylococcus as the cause of disease classified elsewhere. So that diagnosis is also correct. So our correct answer is option C. 70543 with modifier 26, H05.022 and B95.7. Osteomyelitis of left orbit, that is left periorbital. The ICD H05.022 is osteomyelitis of left orbit. That is what is mentioned, diagnosis periosteal abscess. Okay, that is same osteomyelitis. So answer is option C. Now one more question. This is the question which I had missed, like which there was some error from the previous episode that I had promised that I'll be doing in the coming episode. So because all those CPT codes, few CPT codes were deleted codes. That's why I thought I'll retake it again. So let's look into that question once again. A 34-year-old male developed a ventral hernia when lifting a 60-pound bag. The patient is in surgery for a ventral herniorrhaphy. The abdomen was entered through a short midline incision, revealing the fascial defect. The hernia sac and contents were able to easily be reduced, and a large plug of mesh measuring 10.5 cm was placed into the fascial defect. The edge of the mesh plug was sutured to the fascia. What procedure code should be used? So here, what is the procedure done? Ventral herniorrhaphy. The patient is in the surgery for a ventral herniorrhaphy. So here, what are the diagnosis codes? What are the CPT codes given? 49591, 593, 594 and 595. From this you have to find the answer. So the procedure done is repair of hernia. Ventral herniorrhaphy means repair of hernia, repair of the abdominal hernia. So let's check the codes one by one. What is 49591? Repair of anterior abdominal hernia, epigastric, incisional, ventral, anything can be there. Okay. Anyway, ours is ventral, which is already there in the code. Ventral, umbilical, spigelian, any approach that is open, laparoscopic or robotic, initial, including placement of mesh. So in our question also there is placement of mesh. Or other processes when performed, total length of defect less than 3 cm reducible. In the question it is reducible itself. See, the hernia sac and contents were able to easily be reduced. So it is reducible. And here the size is 10.5 cm, which is large. But in the first code it is less than 3 cm. So that's wrong. Now what is the next code? 49593. The size is 3 cm to 10 cm reducible. Here also size is not correct. Ours is 10.5. What is 49594? 3 centimeter to 10 centimeter. Incarcerated or strangulated. This is not incarcerated. This is reducible. Also the size is wrong. So what is 49595? The same description. Greater than 10 centimeter. Reducible. Which is what we need. So large means greater than 10 centimeter. If it is medium, it will be from 3 to 10 centimeter. Sometimes in the question, they will mention only large. There will not be any size. So large means it's greater than 10 centimeter. Medium is 3 to 10 centimeter and small means less than 3 centimeter. Okay. So here anyway in our question both are mentioned. Large 10.5. So the correct answer is option D, 49595. That is a CPT code. Here the insertion of mesh is also included in the CPT code. So friends, hope you like the video. If you have any queries or any doubts or any clarifications, you can always mention it in the comments. I'll be replying back to you soon. So thank you so much for all your support. If you are new to the channel, please subscribe to the channel. And if you like the video, please like and share. And stay tuned for more videos, for more and more questions. Thank you so much, friends. Bye. Take care.